Hey guys, hope you all are doing good. Today we are going to discuss about a very important psychiatric condition that is mania. I think this word is familiar to you guys. Mania means one word will come to our mind, that is hyperactivity. So in this video we will discuss what is mania and what is the meaning of this hyperactivity, to which extent this hyperactivity will reach, and how this hyperactivity will affect the daily day-to-day life of a person. Okay guys, so we are going to the video. So what is mania? Mania is a period of abnormally elevated thoughts and exaggerated behavior. So abnormally elevated thoughts, high energy thoughts, irritable thoughts, and exaggerated behaviors. The symptoms of mania can last for 1 week to more than 1 week, or sometimes more than 1 year. Sometimes mania can be dangerous, guys, and it can create problem to yourself and to the people, those who are taking care of the particular person. So mania can be dangerous. Sometimes the people, those who are affected with mania, will harm themselves. They will show suicidal ideation, and sometimes they will give harm and dangerous or violence to others. Manic episode is common in people with BPAD. BPAD means bipolar affective disorder. In bipolar affective disorder, we can see mania and depression. And of course, this mania could affect the normal life activities of a person, because I've told you, in mania you can see elevated thoughts and exaggerated behaviors, elevated irritable activities, hyper high level of energy. So definitely it could affect the normal life activities of a person, including work, sleep, activities, job, etc., etc. Well, coming to the symptoms, so these are all the symptoms we can see in a manic patient. Very clearly you can see, or it is visible. High level of energy. Whenever they do something, high level of energy you can see comparing to a normal person, and high level of activity. For example, I'm telling to clean the room. To a manic patient means they will take all the furniture out and they will clean. Sometimes they will try to paint the room. In that level, extreme level of activity. Lack of sleep, they'll sleep very little or no sleep, like that we can say. Then wearing bright colored clothes, that means mismatched fluorescent colored clothes they will wear, and they do change the clothes frequently, and they will try to give more self-importance. Then disorganized behavior, rapid thinking, the ideas will fly like a bird. Flying ideas you can see, they will start to talk something, they will end in some other things. Then risky behavior, they will jump, hit, stamp, kind of risky violent behavior they will show. Then another thing is increased desire of sex and abnormal sexual behavior. That is the another thing we can see in a manic patient. Then already I've told you about flight of ideas. Their ideas will fly like anything, will jump from one point to another point. If they're trying to talk about one thing, and they end in other thing, so that is flight of idea. Then another thing which you can observe in the character or of a manic patient is delusion of grandiosity. Delusion of grandiosity means they will try to connect with great personalities, like famous personalities, like celebrities, etc. They will tell, like, I have close contact with the prime minister or some celebrities. If you are trying to talk to them, they will tell, please wait for a while, I have a very important call with PM. Okay, it's PM online. Please 1 minute. I will talk to him and then we will start the conversation. Or they will tell, Justin Bieber is my friend. Okay, the kind of things they will tell always. Then irritability, hopelessness, worthlessness, and high level of religious dedication. If they have some religious belief, means they will try to talk about that always. When you talk to a manic patient, or when you're trying to interact with a manic patient, you can see all these symptoms. Then, while coming to the etiological factors, the exact cause of this condition is unknown. We don't know the exact cause of this condition, but there are some risk factors or triggering factors which create this condition. Among that, first thing is genetic inheritance or family tie. In your generation, I mean your family, grandfather's grandfather, is having some problem, is definitely there are chances to spread to your generation or from your generation to the next generation. But there are chances only. I'm not telling that 100% this is the reason behind mania. Then childhood problems and abuse. If you have undergone any kind of abuse or rape or any kind of childhood trauma or any brain injuries or any inflammation, means there are chances of mania. There are chances because that affect the normal brain functioning, emotional development, etc., and that may lead to mania. Then another reason is severe level of stress. If you have undergone any kind of stress means don't think about minor stress. Everyone is undergoing different kind of stress. Am I right, guys? Everyone in every moment we are undergoing or we are facing different kind of stress. And no need of telling about that, right? Now we are undergoing this pandemic, right? We are facing lot of struggle, but all the people will not get mania and all, but some people will show the symptoms of mania if they are undergoing severe stress and it is beyond their control, means there are chances of mania. And excessive use of recreational drugs also are risk factors of this mania. So there are chances. I'm not telling that these are all the reasons behind mania because we don't know the exact cause of this condition. Well, coming to the types of mania, we can see three types of mania. Among that, first one is hypomania, and that is stage 1 mania. Hypomania or stage 1 mania, from the word itself, you will get the meaning hypo. That means very less amount, hypomania. And this is the first stage of mania, and it is, of course, mild form of mania. And we couldn't recognize the symptoms clearly because the symptoms won't be that much visible in the patient. But the patient will show hyperactivity, impulsivity, and lack of sleep. But in this case or in this stage, no one of going to the hospitals and all, you can keep yourself active. You can do the normal, regular, healthy activities to keep you warm, fresh. That is the only thing we can do. And psychotherapies are very useful in this stage. But hospitalization, taking lot of drugs, that and all, no need in this stage because and it's very difficult to find out the symptoms also in the first stage of mania, and that is hypomania. Next thing is acute mania or stage 2 mania, and it is characterized by increased hyperactivity. Comparing to first stage, some more extended or advanced level of hyperactivity and increased energy you can see in the patient. They will also show the symptoms like lack of sleep. They will get sleep, but very less time they will sleep, and they will talk always, talkative nature. That is the major thing we can observe in acute manic condition. And of course, while talking, you can see this flight of ideas, like jumping from one point to another point. Uh, Minute level of psychosis we can observe in this stage. Psychosis means disconnection from the reality, but definitely they'll come to the reality and they'll try to connect the things with the reality. They'll show minute level, but suddenly they'll come back to the normal and they will try to connect to the reality. But minute level of psychosis we can see. That is the one observable thing we can see in acute mania. Then last stage, that is delirious mania or stage 3 mania, that is the most severe form, that is the third level of mania, and they will show all the symptoms of stage 1 and stage 2, like lack of sleep, irritability, hyperactivity, high energy, everything, exaggerated behaviors, everything, but in very severe or serious way they will show the symptoms, and they will start to show the symptoms of delirium. First they will show delirium, that means temporarily disconnection from the reality. Then they will start to show the severe form of psychosis, that means complete disconnection from the reality, and they will start to show dangerous activity. They will show produce some harm to themselves, and of course they will show harm and they will give harm to others also, and in this stage need to be hospitalized and need to take all the treatment. So these are all the three stages of mania: hypomania, acute mania, and delirious mania. While coming to the diagnosis, how you can find out this condition. So there is no proper test like ECG, EEG, CT, MRI, like tests are not there in most of the psychiatric conditions. We can depend on three things. First thing is history collection, second thing is mental status examination, and third thing is physical examination. If you do these things in proper way, you can understand the condition of the patient properly. So while coming to the diagnosis, three things we can see: history collection, mental status examination, and physical examination. Then while coming to the treatment modalities, two types of treatments we can see, and therapies also we can see. First thing is medical management. Medical management means the condition is mania. So what kind of drugs we can use here means anti-manic drugs. For acute manic episode, we can give antipsychotics. So for acute means the first level of mania, we will give antipsychotic drugs. For example, aripiprazole, risperidone, etc. There are a lot of drugs are there. Only two examples I have given here: aripiprazole and risperidone. These are all the example for antipsychotics. So acute manic stage means doctor will suggest or the psychiatrist will suggest antipsychotic drugs. For long term or delirious mania or severe manic episode, we can give mood stabilizers. That means anti-manic drugs. So anti-manic drugs is otherwise known as mood stabilizers, and the most famous anti-manic drugs or mood stabilizer is lithium, carbamazepine. These are all the major things we can see or we are giving to the patient. Then next is therapy. While coming to the therapy, psychotherapy playing a major role to help to identify the mood changes, and of course the therapy will help to cope up with manic episodes. So mainly or the common therapy which we are providing for this mania are cognitive behavioral therapy or CBT, family therapy, and supportive psychotherapy. I will add the link in the description box. What is cognitive behavioral therapy, what is family therapy, and what is psychotherapy. So cognitive behavioral therapy means we will try to understand the behavior of the patient, and there are some techniques we will use to change the maladaptive behavior into adaptive behavior. Okay, so there are different steps are there to change the maladaptive behavior into adaptive behavior. Some classical conditioning techniques we will use to change the maladaptive behavior to adaptive behavior. Then family therapy. Family can play a major role here because family only is closely observing the patient. So we will give education to the family to take care of the patient. Then supportive psychotherapy to understand the present crisis of the patient. So these are all the major therapy we are giving to the patient to reduce the symptoms. We cannot control completely, we cannot cure the condition completely, but we can control the symptoms with the help of therapy. So therapies are playing a major role in the treatment of mania. Then what are the normal thing? I mean, in the case of first stage of mania, okay, hypomania, some basic things we can do or some basic changes we can do in the life of the patient to maintain their life pattern, to get a healthy life, to avoid the symptoms or to avoid the consequences, to avoid entering into the second or third stage of mania, like rest, exercise, diet, sleep, yoga, meditation, and breathing exercise. So proper rest, that is common. If you use your common logic or common sense, you can understand the importance of rest in our life. If you take proper rest, your body will relax, your mind will relax. Then exercise can helps to release different hormones, especially endorphin. That is a hormone. When it releases, automatically a feel good effect will come in the body, and that will give relaxation to the body. Then proper diet. If you take proper diet, proper blood circulation will take place, proper thought pattern and thinking will take place, and diet is important. Then sleep. Proper sleep is very important. Minimum amount of sleep a person need to take, that the person supposed to take. The manic patient especially, they have to follow a timetable for that, because lack of sleep is the major problem of mania. So sleep hygiene is very important, so need to concentrate on sleep hygiene. Then yoga, meditation kind of therapies will help to give some relaxations to their mind. So in yoga and meditation, if they can get control on their breathe, they can get control on their body postures, and of course they can get control on their concentration. So these are all the things needed to need to practice in their life to change the lifestyle, or to avoid the consequences, or to get a control over their mind, to control on their activities both physically and psychologically. So these are all some basic things which we need to follow. Then another thing is electroconvulsive therapy or ECT. ECT is most probably we don't use ECT, but if the patient condition is too much critical and giving disturbances to themselves and others means and violent to providing or giving violence and giving harm to themselves and others means, in that situation we will give ECT to the patient. ECT means electroconvulsive therapy. That means passing electrical current to the patient's brain. Okay, around 70 to 120 volt of current for zero point 0.7 to 0.15 second will pass to the brain to stop the abnormal discharge of electrical impulses from various parts of the brain. So that is ECT. ECT is useful in patient when they show excessively elevated and dangerous mood. Until unless we don't give ECT to the patient, because there are a lot of side effects are there for ECT. So to avoid that consequences and complication, we don't go for ECT and all first. And too much violent, too much irritated, too much elevated, too much dangerous mood, in that moment the psychiatrist will go for ECT. Then while coming to the nursing management, of course, history collection. Proper history collection. Some history can collect from the patient and some from the family. Then assess the general appearance and motor behavior. Okay, mental status examination. Do proper mental status examination. Then assess the level of mood and affect, because it is very important, because variation in their mood they will show. To understand that, assess the level of mood and affect. Then psychological support. As a nurse, it's your responsibility or the nurse's responsibility to provide maximum psychological support, because they have close contact with the patient always. Then close observation and monitoring. In which moment the patient's mood is elevating, in the which moment the patient mood is coming to normal, in which moment the patient is doing normal things. To understand that, close observation and monitoring is necessary, and follows doctor's order or physician's order. So these are all the basic nursing management. So the management we can classify into three: medical management, nursing management, and therapies. Under medical management, antipsychotics and mood stabilizers we are giving. While coming to the therapy, we are concentrating on three kind of therapy, that is cognitive behavioral therapy or CBT, family therapy, and supportive psychotherapy. While coming to the nursing management, history collection, physical examination, mental status examination, close observation, monitoring, psychological support, etc. And while coming to the nursing diagnosis, okay, there are some nursing diagnosis is here in this slide. Okay, this nursing diagnosis you can use for writing your nursing care plan. Nursing diagnosis are risk for injury related to high level of physical activity as evidenced by bruises and injury in body. The next thing is disturbed sleep related to symptoms of mania as evidenced by sleeping only a few hours. Another thing is imbalanced nutrition, less than body requirement related to refusal to eat meals or food. Next thing is disturbed thought process related to psychotic process, disturbed sensory perception related to sleep deprivation. So these are all some diagnoses, okay, based on the symptoms. So this nursing diagnosis we can use to create the nursing care plan. So this is about mania. So again I'm telling, mania is a condition characterized by high or elevated level of mood and hyperactivity and exaggerated behavior. The exact cause of this condition is unknown, but family tie or genetic inheritance, stressful natures, okay, excessive use of any kinds of drugs are the reasons, are the triggering factors, but not exactly this may cause, okay, 50-50 chances are there for. So these are all the triggering factors behind or risk factors behind mania. So there are three types of mania we can see: stage 1, stage 2, and stage 3, or acute mania, hypomania, and delirious mania. In first stage, that is in the hypomanic stage, you cannot see the symptoms in a proper way because the symptoms won't be that much visible, and no need of hospitalization in that stage, but they will show hyperactivity, impulsivity, and lack of sleep. In second stage, the patient will start to show little bit more symptoms, okay, and they will show the minute level of psychosis also. In the third stage, that is delirious mania, severe symptoms you can see like lack of sleep. While coming to the symptoms, you can see high level of energy, high level of activity, lack of sleep, increased desire of sex, abnormal sexual behavior, flight of ideas, delusion of grandiosity, hopelessness, worthlessness, disorganized speech and behaviors, etc. While coming to the diagnosis, three things you can concentrate, that is history collection, mental status examination, and physical examination. While coming to the management, medical management include antipsychotic drugs and anti-manic drugs, and anti-manic drugs is otherwise known as mood stabilizers. While coming to the therapy, we are giving family therapy, supportive psychotherapy, and CBT, that is cognitive behavioral therapy. While coming to the nursing management, assess the condition, close observation, monitoring, psychological support, etc. Hope you understand, guys. Thank you.